Welcome to Wheatsit's presentation, The Eye. This is Dr. Regina Glenn, and I will be hosting this presentation. Some of the common disorders of the eye include conjunctivitis, cataracts, and glaucoma. The first guideline when assigning codes for glaucoma is to assign as many codes from category H40, glaucoma, as needed to identify the type of glaucoma, the affected eye, and the glaucoma stage. When a patient has bilateral glaucoma and both eyes are documented as being the same type and stage, and there is a code for bilateral glaucoma, report only the code for the type of glaucoma bilateral with the seventh character for the stage. When a patient has bilateral glaucoma and both eyes are documented as being the same type and stage, and the classification does not provide a code for bilateral glaucoma, report only one code for the type of glaucoma with the appropriate seventh character for the stage. When a patient has bilateral glaucoma and each eye is documented as having a different type or stage, and the classification distinguishes laterality, assign the appropriate code for each eye rather than the code for bilateral glaucoma. When a patient has bilateral glaucoma and each eye is documented as having a different type and the classification does not distinguish laterality, assign one code for each type of glaucoma with the appropriate seventh character for the stage. When a patient has bilateral glaucoma and each eye is documented as having the same type but different stages, and the classification does not distinguish laterality, assign a code for the type of glaucoma for each eye with the seventh character for the specific glaucoma stage documented in each eye. If a patient is admitted with glaucoma and the stage progresses during the admission, assign the code for the highest stage documented. Assignment of the seventh character for indeterminate stage should be based on clinical documentation. The seventh character for is used for glaucomas whose stage cannot be clinically determined. The seventh character should not be confused with the seventh character 0 unspecified, which should be assigned when there is no documentation regarding the stage of glaucoma. This ends the presentation on the eye. If you have any questions, please contact your instructor.